Hello and good morning. I hope you all have a great weekend. As promised before, today we are going to talk about laser therapy and its benefits for acute or chronic pain. The world medical community have embraced and validated non-invasive laser as a major tool in the healthcare, injury, treatments, rehabilitation, recovery, or for accelerating wound healing. We all heard about laser hair removal, laser eye surgery, laser tattoo removal, and many other medical treatments which are now utilizing the laser machines in their practice by itself. So, what exactly is laser? Laser stands for light amplification by stimulated emission of radiation. Very, very terminal and very medical term. So, what basically means they use the light to stimulate regenerative process or to give the energy, transfer that energy into the tissue of the patient that is not really working or have degeneration process or started to begin a degeneration process. Now, there are four general classifications of laser therapy. Laser class 1, 2, and 3 are called low-level laser therapy or cold laser therapy. And that is because the machine does not produce any heat. There is no heat factor in this therapy. And because of that, and because of its low power, it does not penetrate more than surface area or couple centimeters into the tissue, which is up to half an inch. Class 4 laser, however, is an FDA approved machine which comes in many different power from 15 watts all the way to 60 watts of power, which is what we have right here. This is the highest power laser machine in the state of Georgia, and we use that in our clinic for our patients. Now, these high power laser machines, the class 4 laser machines, are they have a component of heat, and because of the high power, it can penetrate more than 20 centimeter, which is about 9 to 10 inches deep into the injured tissue. Laser therapy also uses a specific wavelength of light to interact with tissue, and these wavelength and power factors determine the penetration depth, that how deep the machine can go. I'm not going to go into so deep into the terminology, but I want you to understand that the lower the wavelength and the higher the power of the laser machine, the deeper it can affect the target area, and which are what we need for the patient with disc injuries or deep muscle injuries or disc or neuropathy patients. So the mechanism of the laser is very simple. Once the light energy passes through the layers of skin, it reaches the target cells and target area that we want to treat. And it is absorbed and interact with the light, sensitive elements in the cells, and this process is called photobiomodulation. Now, the photobiomodulation is a very medical term. Basically, it means imagine once when the sun is shining down and that light gets absorbed by the plants, and it's called photosynthesis. So the plants use that light, the sunlight, and turns that into an energy, and that energy will let the plant to grow. So when the cells absorb this light, it initiates a series of events in the cell that is theorized and eventually result in normalizing damaged or injured tissue, and a reduction in pain, inflammation, edema, and overall reduction in healing time by increasing the intracellular metabolism or intracellular activity. So the metabolism of the cell would be actually targeted to regenerate and to stop that pain that it's causing. So one of the most important key factor in laser therapy is regeneration of the new cell, which is called biostimulation. Laser therapy has been shown to stimulate the regeneration of the bone, blood vessels, lining of the blood vessels, circulation, nerve, and muscle tissue. And moreover, it has been documented to enhance the quality of the healed tissue, and this is revolutionary. The benefits of the laser treatments are many benefits that I'm not going to go into details of that, but I want you to know something. The stimulation of the nerve ending cells in the body that causes the pain, that chronic pain, or that inflammation that you have that cause that pain will be very much reduced by just one session of laser. Today we have a patient right here that have disc injuries, and we are going to use the machine on him, and I just want to show you how the machine would work. He's having a lot of low back pain, and also as a result of that he's having the right side sciatica, which has been affecting his muscles and his walking. So we're going to use the machine. I'm going to use it for a couple minutes and show you how the machine would work. Because this is a class 4 laser and it does produce heat, you also have to wear the glasses, and the patient have to wear glasses to not get the laser into the eye or cause any damage to the retina. Since the patient is laying down, we don't need to use the glasses for him, and I will just demo this machine. As you can see, the machine comes with many different applications for many different conditions, anywhere from sinusitis to toenail fungus to regenerative therapy for disc, ligaments, or tendons, and it is one of the fast healing system and healing treatments that we have right now in the medical field. So, I'm going to start the machine. Are you okay?
I'm okay.
All right. Let's go. We're going to put the machine for 30 watts. And what you're going to feel is just a very soothed heat. If it gets too much, let me know, and I'll move it faster. So, as you can see, the head of the machine is not even touching the patient, and it creates a very nice heating and soothing heat for the patient. At the same time, it is penetrating deep enough into the surface of the disc and the nerves around it to reduce the inflammation, and also it causes the pain patterns to stop and the pain gates to stop. So we go in the pain patterns of the nerve roots, go up from all the way from the base of the skull and to the area of it's causing the pain. And right now we are having the L4, L5, which is the low back disc, and affecting the sciatic nerve going to the right side. You doing okay?
Yes.
Not too hot?
No, it's good.
Okay. As you can see, it's very soothing for the patient, and we are just moving it just like that to get the heat go evenly all over, and to get that laser light penetrates deep enough to that tissue. So this would be our treatments for almost any condition that you have. I hope you enjoyed this video, and if you'd like to share our video with your friends and family, please do so they know there are other sort of treatments available for them if they've been suffering from chronic pain or inflammation for a long time. And please like our Facebook page so you can get up-to-date news and podcasts and videos for future. And I hope you enjoyed this video. I'll see you guys all next week. Thank you so much. Have a wonderful week. Bye bye.